Hello everyone, now let us discuss about CPT coding guidelines for radiology part 3. In the current session, we will be focusing on diagnostic ultrasound, especially pelvis, in that obstetrical codes. Now coming to the diagnostic ultrasound of pelvis. The diagnostic ultrasound of pelvis is broadly categorized into obstetrical and non-obstetrical. In the current session, we will be focusing on the obstetrical diagnostic ultrasound of pelvis. Now let us discuss some of the key elements that are required for assigning the codes. While assigning 76801 or plus 76802, we must take into consideration the following. So these codes 76801 and 76802. The plus sign indicates 76802 is an add-on code. They include determination of number of gestational sacs and fetuses, gestational sac or fetal measurements appropriate for gestation younger than 14 weeks. For diagnostic ultrasound of pelvis, obstetrical, that too transabdominal, younger than 14 weeks, we assign 76801. And this code 76802 is an add-on code which is given additionally for each additional fetus. So for determination of fetal movement and gestational sacs, survey of the visible fetal and placental anatomical structure, qualitative assessment of amniotic fluid volume, gestational sac shape, and examination of the maternal uterus and adnexa. These are the elements that must be considered for assigning 76801. This is given for younger than 14 weeks. That is for first trimester only. Coming to next code 76805 and the add-on code 76810. 76805 used for the determination of number of fetuses and amniotic or chorionic sac, measurements appropriate for gestation older than or equal to 14 weeks, 0 days. For second and third trimester, you assign 76805. The survey of intracranial or spinal or abdominal anatomy, 4-chambered heart, umbilical cord insertion site, placenta location, and amniotic fluid assessment, and when visible, examination of the maternal adnexa. So these are the points that are covered to assign 76805, and plus 76810 is used for additional fetus. It should be used in conjunction with 76805. Similarly, 76802 should be used in conjunction with 76801. Coming to the next codes, 76811 and plus 76812. While assigning 76811 and 812, all the elements of the codes for 76805 and 810 plus detailed anatomical evaluation of the fetal brain, ventricles, face, heart or outflow tracts, chest anatomy, abdominal organ specific anatomy, number, length and architecture of limbs, and detailed evaluation of the umbilical cord and placenta and other fetal anatomy as clinically indicated. Whenever you assign 76810, in addition to codes, all elements for 76805 and 816, there will be a detailed anatomical evaluation of fetus. Whenever there is detailed anatomical evaluation of the fetus, we must assign 76811. and this is an add-on code 76812 for each additional fetus. This must be used in conjunction with 76811. So what are the points that must be taken into consideration while assigning the appropriate code? The first point is assessment. That is, what are we going to determine in that particular examination that we have discussed in the previous slide. The next is based on age of gestation. So which code is appropriate as per the specified gestational age? So based on age of gestation, codes are categorized into either younger than 14 weeks 0 days or older than or equal to 14 weeks and 0 days. So for first trimester of the pregnancy, we must assign codes younger than 14 weeks 0 days. Those codes are 76801 and plus 76802. Detailed description of the codes will be discussed in the further session. So just as of now, for first trimester, we must assign 76801 and 76802 is the add-on code for each additional fetus. And similarly for second and third trimester of the pregnancy, we must assign codes that come under the category older than or equal to 14 weeks 0 days. They are 76805 and the add-on code 76810. Similarly 76811 and the add-on code 76812. One more important point is report should document the results of the evaluation of each element described above or the reason for the non-visualization. The elements which we have discussed in the previous slide should be reported and documented in the report, or else the reason for non-visualization should be mentioned. Now coming to other codes 76815, 816 and 817. What is 76815? Focused quick exam limited to assessment of one or more of the elements. For example, if the patient comes for ultrasound and only fetal heartbeat is assessed, in such cases we can assign 76815. Now coming to 76816. This involves examination designed to reassess the fetal size and internal growth or re-evaluate one or more anatomical abnormalities of the fetus previously demonstrated on the ultrasound and should be coded once for each fetus. And for each additional fetus, as in case of twin pregnancy or triplets, you need to use modifier 59 for each fetus after the first. So whenever there is fetal abnormality in the previous ultrasound and when you come for re-evaluation of that anatomical abnormality, you need to assign 76816. Now coming to next code 76817. That is nothing but transvaginal obstetrical ultrasound performed separately or in addition to one of the transabdominal examinations described above. One important note is for non-obstetrical transvaginal ultrasound, you need to code 76830. 76817 is only for transvaginal obstetrical ultrasound. That is to assess the pregnant woman. When the patient is non-pregnant, you need to assign 76830. Now let us discuss the detailed description. So what is code 76801? That is nothing but ultrasound pregnant uterus, real time with image documentation, fetal and maternal evaluation, first trimester, that is nothing but less than 14 weeks 0 days, transabdominal approach, single or first gestation. And the next code is plus 76802, which is nothing but an add-on code for each additional gestation. List separately in addition to the code for primary procedure and usually use 76802 in conjunction with 76801. Now coming to the next codes. Codes for obstetrical transabdominal ultrasound for second and third trimester. They are 76805 and plus 76810. The description of 76805 is ultrasound, pregnant uterus, real time with image documentation, fetal and maternal evaluation after first trimester, that is greater than or equal to 14 weeks 0 days. Transabdominal approach, single or first gestation. And for each additional gestation, you need to add plus 76810. Usually use 76810 in conjunction with 76805. Now coming to codes for obstetrical transabdominal ultrasound with detailed fetal examination. They are 76811 and 76812 plus 76812. Description of 76811 is ultrasound, pregnant uterus, real time with image documentation, fetal and maternal evaluation plus detailed fetal anatomical examination. Transabdominal approach, single or first gestation. And for each additional gestation, you need to use the add-on code plus 76811 for detailed fetal examination. Now coming to codes for obstetrical ultrasound with fetal nuchal translucency measurement, which is nothing but fetal growth measurement. The codes are 76813 and plus 76814. Ultrasound, the description of 76813 is ultrasound, pregnant uterus, real time with image documentation, first trimester, fetal, nuchal translucency measurement, transabdominal or transvaginal approach, single or first gestation. And for each additional gestation, you need to use the add-on code 76814. Now coming to codes for obstetrical transabdominal ultrasound for limited and follow. They are 76815 and 76816. The description of 76815 is ultrasound, pregnant uterus, real time with image documentation, limited. Example, fetal heartbeat, placental location, fetal position and or qualitative amniotic fluid volume, one or more fetuses. So even for triplets and twins, you need to use only 76815. For ultrasound, pregnant uterus, real time with image documentation, limited. That it assesses only one or couple of elements. The next code is 76816. Ultrasound, pregnant uterus, real time with image documentation, follow-up for re-evaluation of fetal size by measuring standard growth parameters and amniotic fluid volume, re-evaluation of organ system or systems suspected or confirmed to be abnormal on previous scan. Transabdominal approach per fetus. That is the description for 76816. And report 76816 with modifier 59 for each additional fetus examined in multiple pregnancies. In case of twins or triplets, you need to report 76815 with modifier 59 for each additional fetus examined. Now let us look at an example. A patient in her second trimester with a triplet pregnancy. is seen for an obstetrical ultrasound, only including fetal heartbeats and position of the fetuses. What CPT is reported for the ultrasound? Here the ultrasound is limited, which includes only fetal heartbeat and position. So the correct option is 76815. Ultrasound pregnant uterus real time with image documentation limited. Example, fetal heartbeat, placental location, fetal position and or qualitative amniotic fluid volume for one or more fetuses. This point is important. So even for triplets or twins, you report only 76815 once. The next code is 76818. Fetal biophysical profile with non-stress testing. The code for fetal biophysical profile with non-stress testing is 76818. And the code for fetal biophysical profile without NST, which is nothing but non-stress testing, is 76819. So with NST the code is 76818. Without NST the code is 76819. Let us discuss some more examples. What CPT will be assigned for grayscale obstetrical ultrasonography of the maternal pelvis and second or third trimester pregnancy was performed transvaginally? Here the patient is pregnant woman in her second or third trimester and the ultrasound is performed transvaginally. The code is 76817. Ultrasound pregnant uterus real time with image documentation transvaginal. Let us discuss one more example. 25-year-old female in her last trimester of pregnancy comes for a fetal biophysical profile and ultrasound is used to first monitor the fetal movements, non-stress testing of 30 minutes. Here the biophysical profile is with non-stress testing or NST of 30 minutes showed heartbeat of 120 per minute increased with movement. Biophysical profile scored 9 out of 10 points. What CPT will you report? The answer is 76818. Fetal biophysical profile with NST or non-stress testing. Now let us discuss some more codes. For Doppler velocimetry, the codes for Doppler velocimetry are 76820 and 76821. The description of 76820 is Doppler velocimetry fetal umbilical artery. So when you assess the umbilical artery of the fetus, the code is 76820. And for Doppler velocimetry fetal middle cerebral artery, the code is 76821. Now coming to echocardiography. Echocardiography of fetus. The codes are 76825 and 76826. Description of 76825 is echocardiography fetal cardiovascular system real time with image documentation 2D with or without M mode recording. And for follow-up or repeat study of echocardiography fetus, you assign 76826. Next is Doppler echocardiography. The codes are 76827 and 76828. The description of 76827 is Doppler echocardiography fetal pulsed wave and or continuous wave with spectral display complete. And for follow-up or repeat study, you assign 76828. Follow-up or repeat study of Doppler echocardiography for fetus, you assign 76828. And to report the use of color mapping, you need to assign code 93325 additionally. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.